Hi, I'm Abigail Mullins, recording speech number 3, informative speech on coronary artery disease. Your heart is the most important muscle in your body. It is the equivalent of a steam engine to a train, and that is why it is important to take care of it. Our hearts are responsible for pumping oxygen-rich blood all throughout our body, and if our hearts aren't healthy, then we're not healthy. According to the Cleveland Clinic, your heart is responsible for pumping over 3,000 gallons of blood every single day. CAD is a serious heart disease that affects millions of people each year, but there are steps that you can take to prevent it. As a student of speech and anatomy, I'm qualified to learn and to properly research facts in order to receive the most transparent information possible. Because CAD constricts your arteries and prevents adequate blood flow to the heart, it can result in an array of problems. In order to take a proper look at CAD, we have to be able to define it. Films for the Humanities and Sciences firm states that coronary artery disease results from a buildup of fatty deposits called plaque. The plaque builds up and narrows the arteries, and a heart attack occurs whenever the plaque ruptures and the blood clot closes off the blood supply of oxygen to the artery. So as you can see here, this is a heart with coronary artery disease, where fatty deposits are blocking up the proper blood flow to the heart. As you can see here, there is a artery with CAD next to a clean artery that does not have CAD. CAD is fatal if it goes undetected, so here are some things that we can look for. Symptoms of CAD include chest pain, also called angina, shortness of breath, fatigue, and in major cases, heart attack or death. Some other symptoms can include nausea, sweating, increased heartbeat, and dizziness. So in order to protect ourselves from CAD, we need to know what causes it. The Mayo Clinic states that coronary artery disease starts whenever fats, cholesterols, and other substances collect into the inner walls of the heart and arteries. This is a condition called atherosclerosis. The buildup is called plaque. Plaque causes the arteries to narrow, blocking off proper blood flow. And the plaque can also burst, leading to a blood clot. This is caused by risk factors that are both preventable and non-preventable. The National Library of Medicine states that in these case studies, it was concluded that the risk factors of CAD are both non-modifiable and modifiable, meaning that there are some things that we can't do that will change the outcome of CAD, but there are some things we can do to lower our risk. Non-modifiable risk factors include gender, age, ethnicity, and family history of CAD, while modifiable risk factors included hypertension, hyperlipidemia, diabetes, obesity, smoking, poor diet, a sedentary lifestyle, and stress. Now, if somebody already has CAD, there are some things that we can do to treat it. Medications include cholesterol and blood pressure reducers, as well as blood thinners, so that if somebody does develop a blood clot, it's not as severe or as fatal. Treatment procedures include an angioplasty or a stent placement, which includes a stent placement includes opening the artery so that blood can pass through, and also a coronary artery bypass graft, which is grafting a vein from somewhere else in the body in order to open up that blockage. Now, CAD is responsible for over 3 million deaths a year, and it is the most common cardiovascular disease in the world, but we are not totally helpless. According to NYU Langone Health, the best ways to prevent CAD are to lower blood pressure and high cholesterol, refrain from excessive amounts of smoking and drinking, and monitoring our risks of diabetes while maintaining a healthy weight and staying active for at least 15 minutes a day. Whoop, that's it. So in this speech, we have learned what CAD is, and we have determined its causes and its preventable risk factors so that you can take all of the necessary steps to lead a healthy and a happy lifestyle so that you can keep your heart healthy and yourself happy. Thank you.